morning. Wake up, guys. Connect with me. Thank you very much for connecting. And that's the most important and critical thing in healthcare, connecting with your patients, your care providers, caregivers, and amongst yourself as a healthcare provider. So thank you, CAHO, for giving me this opportunity to be here today, this morning, and giving opportunity to present you something different. So you have all traveled to Australia, from India to Australia, and then you went to United States. And I'm sorry, I'm bringing back you all to India. So bear with me for next 15 minutes to present to you a new world of healthcare accreditation, which we think we have crafted for every one of you in a different manner, but not entirely. There would be some overlaps, but it would be good to see how things are moving nationally and internationally. Thank you, CAHO, once again for bringing me to this place, Hyderabad, where from I started my professional journey 25 years back as a scientist in Vimta Laboratories, and then a brief stint in Center for Cellular and Molecular Biology, CCMB, before I moved to NABL in 1999. Worked there for 6 years, and then Dr. Gyani, sir, are you here? He's here. And he said, Rana, we want to start healthcare accreditation, and you have a background because I started medical lab accreditation program as per the new standard 15189 for the first time in India, go back 2002-03. And then 2006, I've left NABL and joined QCI as the deputy director, as the first staff of NABH to start off NABH accredited, which the technical committee started off for developing the standards. Stayed there for a couple of years, and 2017 moved out to start the new body in the corner, QAI, Quality and Accreditation Institute. So I bring you back, and thank you very much, and a couple of colleagues, Air Marshal Kapoor sitting here, Dr. Ravi from Malaysia, been my secretary of ESCO when I was the president in 2010-11. Thank you, Ravi. And Shin sitting here as a ESCO board member when I was member, and I think, where is CEO, ESCO? Is good? So he was my deputy chair of ISCO Accreditation Council when I was chairing the ISCO Accreditation Council for 4 or 5 years from 12 to 16. So ladies and gentlemen, just give me a few moments to make you understand what we are doing and how different it is, and it may not be different for you. So Quality and Accreditation Institute is an independent organization. We set as a body for providing a largest global pool of individuals and organizations to bring quality improvement and change in healthcare, delivery systems and models. This is our vision we set for ourselves. We started off in 2017, and I can say we are the fastest developing accreditation body. Sorry, Joel and Luis, saying that, but the claim is based on the number of standards, which are 14 at the moment when I'm speaking, developed in less than 5 years. No accreditation body in the world has developed these many standards this much time. This is our organogram, very small, but different verticals, set apart for different activities, for education and training, then for healthcare accreditation, CHSC, for laboratory accreditation, CLA, and Center for Veterinary Accreditation. This is the first time in India we don't have a standard for veterinary hospital clinic for accreditation. We developed them with the help of government, Department of Animal Husbandry and Dairying, Government of India. We also have incorporated QI International in Canada to operate little beyond our boundaries to operate globally. Center for Laboratory Accreditation chaired by, it's a board, full board, chaired by Professor Bikram Kumar, who is the former director of CSIR National Physical Laboratory, supported by many other eminent people, including Professor Venkatesh as one of our board members for this. We offer 5 programs, medical lab accreditation program as per ISO 15189, which is international standard, then a standard based on Clinical Establishment Act, Government of India for recognizing the labs for quality improvement, then for testing laboratories, calibration laboratories, and biobanking. Biobanking is a new area, particularly for India. We started off first time in India in 2021 as per ISO 20387. And we become not only the first and only accreditation body in India, but we were the third when we started in 21 after A2LA, which is in a United States accreditation body, and then China, CNAS. So we were the third accreditation body globally. We accredited National Liver Disease Biobank as our first client in government. We are international. You can compare with NABL, which is the first organization in 1999 to 2006. We bring international equivalence and acceptance through our international MRA or APAC and ILAC, which gives equivalence to QI accreditation program, not only in India, but globally. Then Center for Accreditation of Healthcare, which is the core for all of you, perhaps. We have a full board again, headed by Professor M.C. Mishra, former director of AIIMS New Delhi, and supported by, again, Dr. Venkatesh as one of the members, Dr. Alok Rai, Vivek Desai, Dr. Rakesh Verma sitting here, is the chair of our accreditation committee as well, and Mr. Madan Gopal, who is the former health secretary of Karnataka, and Joy Chakravarti, COPD into the hospital. So we are really supported by well-eminent professional in healthcare. We are not much in numbers, but we are growing steadily. As I speak, we are on 69, steadily growing and sustaining over a period of time. We are happy and proud to say that QI became the first accreditation body in India to achieve ISCO accreditation in less than 5 years of starting operation, which is last year, which we targeted for 3 years in 2020. And we were set for a ISCO evaluation in April 2020, but COVID came and we were pushed 2 years, which we achieved last year, but we are the shortest period we achieved it. We are the first and only accreditation body, as I speak here before you, in India, having 3 sets of standards, home care, dialysis, and hospital standards accredited by ISCO. So we are the only one, right? You can clap for yourself. Don't hesitate. It's not a comparison. It's not a claim for competing with someone. We are here to complement and supplement and complement the existing healthcare accreditation. Of course, they were my earlier organization, NABL and NABH. So we are here to support, not to compete. We are, of course, recognized by Central Government Health Scheme, CGHS, for empanelment of hospitals, eye center, dental centers, and imaging for CGHS empanelment scheme as equivalent to NABH accredited hospitals. So we have already over 3 dental centers accredited by us and empaneled by CGHS. We are ISCO institutional member. We are also the board member of International Society for Telemedicine and E-Health. We got elected last year for 3 years. We publish a journal, QI Journal for Quality and Patient Safety, free journal, online, free access. Anybody of you who are publishing, I heard good papers in the morning, you may like to consider for publishing in this journal. This is our gold mark, accreditation mark, a mark of sustained quality. We believe in sustaining quality. If you are able to sustain over a period of time, you will bring quality and patient safety along. Couple of clients ranging from top players in country. We are leaders in home health care. The top player, Apollo Home Care, Max Home Care, Antara, Portia Medical, they are our accredited clients. Similarly for IVF, Indira IVF, Apollo Fertility, Oasis Fertility, they are our client. And we are leader in these programs, and as well as telehealth. So Portia Medical, which is the largest home care provider, as well as Practo, which is the largest in private sector, the telehealth provider, accredited by us in India. And we have accredited one client in Dubai as a Dubai hospital. And several others, as you can see over here, are joining us. And now coming to what we were talking about is evolution of or transition of standards, optimum to excellence. What does it actually means? You know, there are minimum standards which are basically for regulations or licensing of a healthcare facility. Those are the minimum standard. Basically, they are based on mostly on the structures. Mostly structures, maybe few process if there are. Then the next level is a minimum, but little bit of optimum types of standards. They are used in certification. So don't get confused with certification in ISO world. That's totally different game in ISO. But in healthcare, we use accreditation, certification interchangeably. So in India, particularly, we use certification a little above than the minimum, but lower than the accreditation standard based on structures and processes, and little bit of outcome they have, like you have heard of NABH entry level. So we have a certification standard as well, equivalent to that. Then moving to the optimum, which are not the highest, but near to that, the accreditation standards. And we say structures, process, and outcome. So structures process essentially to be there. Little bit of outcomes here is difficult to measure outcomes. And that's why I think all of the accreditation body globally, including ACHS, ACI, JCI are working towards how you start measuring outcomes in real time in healthcare organization to see real benefits of accreditation. Now moving along to the excellence. And excellence is like I will talking about the what after accreditation. Going beyond accreditation is excellence. And they are basically structures, process, and then of course outcomes. So you have to really measure outcomes. You have to demonstrate your outcomes by case review, the file review, and you demonstrate. So we moved on to that, and we keep the patient, of course, everybody keeps the patient in the center. The patient remains in the center. So now we cover the whole care continuum of a patient journey, starting from a clinic, moving to ambulatory care. It may be a dental center, eye center, imaging center, daycare surgery center, it may be rehab, OPD, any ambulatory care is here. Moving on to hospital. A small hospital, big hospital, tertiary care, secondary care, we have that standards for that. Then moving on, home health care, again is specialized, but again is structures process as a holistic approach. And by the way, QI home care standards are the first standard, were the first standard at the time, which got accredited by ISCO for the first time in the world. Then transition care standard, the new standard. Transition care standards are basically comprised of a couple of services, almost 5 types of services. This is out of hospital care. So patient come out of the hospital, go to transition care, and there may be inpatient rehab center, de-addiction center, geriatric care, assisted living, senior living. So there are 5, 6 types of care which is covered in the transition care standards. Then telehealth. We developed for the first time telehealth standard in India, and we moving on. So you are not at home. If you are at not a hospital, you are in transition care. If you're not there, you are at home, so you receive care at home. We have the standard for that. You are not in any facility. You may be on a beach. You want services, you have telehealth, right? So you connect with the doctors and providers, you get telehealth. We have the accreditation standard for telehealth. So we cover entire ecosystem for. Then we, of course, developed standard for hotels during pandemic because patient was staying in there, and then we were approached by the tourism sector to develop. We didn't publicize much, but we start going again. We got a lot of requests for the hotel accreditation. Then green healthcare facility for hospitals and any type of healthcare facility, we do have a standard for that as well. Then patient safety based on WHO patient safety friendly hospital standards, and I'm happy that we certified first hospital in India, which is Continental Hospital here in Hyderabad. Then now moving on from Optimum standards, accreditation standards to excellence, little bit focus on a specific area, home care, and then patient safety, then emergency department, and then dialysis. So very focused dialysis with outcome measures given in there. And then assisted reproductive technology, IVF program. And if you go by the WHO definition, infertility is a disease. So this was the first disease-specific accreditation program in India, which we developed in 2018. And we have a top player for our country which signed up for this program. And then latest is our primary and advanced stroke center accreditation program, completely excellence program based on outcome measure. When the hospital says, my door to needle time is 45 minutes, then they have to demonstrate by case reviews, patient file reviews for that. So they are moving on to excellence for that, covering from optimum to specific to excellence. And of course, every standard has to move to the next level as a priority. We are really committed to support person or people-centric care, as my earlier colleague also mentioned, which means the patient in the center, the family around, the community around, and everything around, which really takes care of everything in the care continuum. Patient and healthcare worker safety. Healthcare worker safety is very important if you're really looking for patient safety. Of course, supporting the government of India's vision for Atmanirbhar Bharat, providing you a program which you need not to look for anywhere else. You get it here. And of course, Heal in India, which is going on the mission for government, and Heal by India by providing healthcare destination in India for medical travel at the par with anywhere in the world, as well as supporting and providing healthcare professional to outside world. Of course, universal health coverage, we support through quality, because universal health coverage means accessibility, affordability, and quality. So third leg of USC, through the quality, we are able to support it. And then patient for patient safety initiative, you heard yesterday, we have installed, which is now a foundation, is an initiative of QI and CAHO for supporting the patient involvement in their own safety. Then we have a very specific program called Q School, which is a QA and OCD initiative to empower and scale medical lab technicians particularly. We have done 7 languages training program, over thousands of people trained, and moving on to different languages as well. Now, we understand you better. That's our philosophy. Change, adapt, improve is our tagline, to believe and understand that we can help and support healthcare organizations in their journey for improvement and achieving excellence. Thank you very much, ladies and gentlemen, for giving me time to listen to me. Thank you very much.